I'm Dr. Joe Esposito, and welcome to our podcast, For the Health of It, episode 51. Remember to subscribe to our podcasts, and I'll help you naturally get well and stay well.
The information presented on this program is not intended to take the place of your personal physician's advice, and it is not intended to diagnose, treat, cure, or prevent any disease. Discuss this information with your own physician or healthcare provider to determine what is right for you.
Are you suffering needlessly? Dr. Joe can give you advice on how to naturally get well and stay well. Dr. Joe Esposito.
Hey folks, Dr. Joe here. So glad, as always, we could spend a little time together today. And I've talked about this topic before, but there's so much to cover, I got to cover it again. And we're going to talk about diabetes today. And diabetes and something called prediabetes. I want you to understand that difference. Because sometimes in medicine, we come up with something and we say, okay, well, if we change that, well, maybe we can sell more medication. Maybe we can get more people aware. There's a lot of different motivations as to changing the standards. And diabetes was a thing, and you had your diabetes and you were done. But now we're talking about something called prediabetes. And now here's my spin on this. If you have prediabetes, that's a warning sign. It's telling you the next step is diabetes. My concern is that sometimes people get a little nervous and they start saying, I need to take medication for this. Now, I'm not a medical doctor. I'm board certified in chiropractic, orthopedics, pain management, double board certified in nutrition, BS in nutrition, a retired dietitian, award-winning author. I have my books here, my own line of supplements, been in practice 34 years. So I'm not telling you to take drugs or not take drugs. I'm telling you what I would do if I was diagnosed as pre-diabetic. I would take that as a warning sign. And I would say, okay, you better start paying attention. Had a patient come in, was it yesterday, the day before, I can't remember now. And his paperwork was just pages and pages and pages. Everything he could imagine wrong. And he was diabetic, and he had high blood pressure, and he was acid reflux, and he had numbness and tingling, and he had everything. And I said a simple question to him. I said, do you do anything to take care of yourself? He goes, no, not at all. I have a horrible diet. I drink excessively, and I smoke constantly. Okay. So even if we put him on medication, by the way, he was on medication, even if he's on medication, that's only treating the symptoms and delaying the inevitable. I don't want you to delay the inevitable when it comes to your health care. And unfortunately, this is what drives me nuts. So many people just delay the inevitable. I've got neck pain and I take some ibuprofen, which is fine if you want to take it, or acetaminophen. However, it's just getting worse and worse. So when I used to take one, now I take two, now I take four, and I take a handful, and the opioids didn't work on me, or I took the opioids and I got addicted. And a million stories. But never, well, I shouldn't say never, hardly ever, the patients come in and say, Dr. Joe, I want to get to the cause. I've gotten to the cause of my problem. And that's where I really want you to start thinking. So prediabetes, if you want the official diagnosis, it's also known as impaired glucose intolerance. It's to describe the early state of progressing insulin resistance, conventionally diagnosed by having a fasting blood sugar between 100 and 125. So if you're below 100 fasting blood sugar, you're okay. 100 to 125, pre-diabetic. Above that, we start calling it diabetes. So 14% of American population is diagnosed with having type 2 diabetes, also known as insulin resistance. The research is pretty clear that in most cases of insulin resistance or type 2 diabetes, you have control over what direction it goes in with lifestyle. Lifestyle is the key to getting this thing fixed. Now, as a chiropractor, I always check the nerve supply as well. The sixth thoracic vertebrae right in the middle of your back is the nerve supply that goes into the area of your pancreas. And so I always want to check the nerve supply to an organ whenever somebody comes in with an organ problem. In fact, I've done postgraduate work, and it's a 4-hour class that I do for doctors, and it's on pain management and nutrition. And the first thing I start out with is headaches. And what might cause a headache? Well, pinched nerve, of course. Could be food reaction, could be chemical reaction. And then I come up with a slide, and it just lists a bunch of other causes that could be causing your headache. But a lot of those things on that list, you have control over, just like with the diabetes. You have control over a lot of these issues. And now you just have to take responsibility for it. So if 14% of Americans are pre-diabetic, suggests about half of Americans are either pre-diabetic or diabetic. Number one reason I see patients in our office is pain. Number two reason we see patients in our offices is digestive problems, acid reflux, heartburn, burping, gas, bloating. And we try to fix it. We try to pull the stomach away from the diaphragm, get the organs to relax, open up the nerve supply, straighten out the diet. And in most cases was successful. But the number one reason medication I see is high blood pressure medication. Number two is cholesterol and diabetes is kind of tie, I guess. I've never done an official count on that, but it's real close. And so if we just did some simple things, like fixing the nervous system and the digestive system and your diet, hopefully we can drop a lot of those meds. I always tell my patients, I never want you to come off your meds without your doctor's approval. But if I can get you healthy enough, then you won't need the meds. And that's kind of the approach that we need to take. 20% of the population in every U.S. state is obese, not just overweight, obese. So look around. It's an issue. I got invited to a dinner the other day. A friend of mine is a raw food chef. He does nothing but raw foods. And periodically, he holds these classes. And it's really great because when people have really serious diseases and they want to get to the really high level of it, I'll say, listen, we're going to get you on some supplements. I want you to start going more raw food. And so he had a class and he invited me and it was kind of fun. And I was talking to one of the gals there and she was there's a girl from Georgia, a girl from England, and a girl from Cincinnati, I think it was. And she said, we have to do something about the obesity problem. In America, it's horrible. I was like, yeah. I mean, it was like, hello, Captain Obvious there. Obviously, it's an issue. And even as I get older, I have trouble losing weight. It's a real challenge. And so you got to you have to change your lifestyle in order to maintain weight as you get older. Exercise is probably about 10 or 20% of weight. Diet is most of it. And hey, I like eating just like you do. But when you start to realize the dangers of being overweight, there's the problem. We're going to talk about insulin resistance and leptin resistance and all that together. So we're going to cover all that today. A third of normal weight adults are also pre-diabetic. So just because you're normal weight doesn't mean that you're free of being diabetic or cancerous or anything else. So one of the things I want you to start considering, you got to get your vitamin D levels up. I was a guest on a show the other day, a friend of mine, Eric Von Hessler, and topic came up of flu season. And he said, well, the flu season, it's going to be worse than ever. Every year they predict it's going to be worse than ever, worse than ever. I've never heard him say it's going to be a good flu season ever. And make sure you get your vaccines. And we do, 3 or 4 different strains in the vaccine, guessing what strain to use because we're looking at what happened in Asia and we're predicting it's moving this way. And if that strain is popular over there, it's going to move this way. And so there's an algorithm that they figure out on that. And he said, so pretty much there's nothing you can do about it. If you're going to get the flu, you're going to get the flu. If somebody sneezes on you, you're going to get the flu. And I said, no, all of us are exposed to flu virus. However, if you take control of your health, if you stay away from sugar, in my book, Prescription for Extreme Health, we talk about how sugar affects the immune system. I said, and one of the keys that everybody is missing, and I promise you this is going to become big news as whenever we talk about something, it becomes, headline news 5-10 years later, is you have to get your vitamin D levels up. And there's 2 types of vitamin D. There's vitamin D3 and vitamin D2. Vitamin D2 is the synthetic version of vitamin D3. So if you take vitamin D2, it's going to be converted into vitamin D3. Why not just, take vitamin D3? Well, there's a novel idea. And I take it every day. In the winter, I take vitamin D every day. And you spread it out over time because you can only absorb so much of anything. So if I'm giving you 50,000 international units of vitamin D3, the vitamin D2, some of that's going to be converted into D3. So we got to really mega dose you, so to speak, in order for you to convert some of it. Why not just take a little bit of vitamin D every day? I take 5,000 international units of vitamin D. But sunlight is going to be key to helping metabolize sugar. You utilize sugar more efficiently. Ever been out in the sun and then you're exhausted? Guess what? You just utilized all your sugar in your blood. Not all your sugar in your blood, but you utilize it better. So I want to get to the cause of type 2 diabetes so you understand what we're talking about here. Conventional medicine has it pegged as a blood sugar problem. It really isn't a blood sugar problem. It's an insulin problem. So what happens is you eat sugar, breads, cookies, cakes, donuts, pastas. How many people do that every day? Most of you. I have trouble not doing it every day, I'll be honest with you, because it's so it's everywhere. And so it's such a part of our culture that breads, cookies, cakes, donuts, and pastas and other forms of sugar, ice cream, cakes, sodas. You put sugar in your coffee, which you shouldn't be drinking a coffee anyway. And the sugar just blows out your immune system. And so cutting out the sugar is going to be key, not just for managing diabetes and prediabetes and blood sugar, but for also helping the immune system. So what happens is you eat sugar, the pancreas releases insulin. Insulin gets into the cells and it kind of acts like a key. It opens up the cell and it allows sugar, glucose, the form of sugar we use is glucose, to get into the cell. And then the cell utilizes that sugar and it uses it as fuel and it makes the mitochondria work and it does its thing. However, if you eat a lot of sugar, you release a lot of insulin. And it's not your body is releasing like molecule for molecule, molecule of sugar, molecule of insulin. It dumps a ton of insulin because it can't have the sugar floating around in your blood too long. It's dangerous. It can kill you. So the body says, uh-oh, a lot of sugar. Get a lot of insulin out there. And so the insulin is released. Oh, side note, we always thought the pancreas was the only organ that released insulin. Turns out your brain can produce insulin as well. Another story for Alzheimer's and brain function, but that's not today. So the insulin is released, and now it opens up the cell and the sugar gets in. But the cells can only take in so much sugar. And if you have more insulin than you need, the insulin is trying to open up the cell and letting the sugar and open up the cell, sugar in. And finally the cells say, stop it. I can't let any more in. If I get more sugar in here, I'm going to gunk up the system. And so what happens is the cells become insulin resistant. So you have sugar in the body. The cells are being stubborn. I'm not going to let any sugar in. Well, metaphorically speaking, they're letting some in. Of course, you'd be dead. I'm not going to let any sugar in. And sugar's floating around in the blood going, I don't know what to do now. My job is to go into the cell and work, but I'm not there. So what do I do? So the body converts it into glycogen. Glycogen is where we store sugar. That's a kind of reserve tank in case you are fasting and you run out of fuel. And once the glycogen stores are all used up, your body converts that sugar back into triglycerides where it gets stored as fat. Now, stomach produces a hormone called leptin. Leptin goes up into the hypothalamus and tells you that you're full. Fat also produces leptin, which goes into the hypothalamus and tells you that you're full. Well, guess what? The hypothalamus, the part of your brain that controls hunger and temperature, by the way, is being bombarded with leptin, and the hypothalamus does what the cells did. I'm not going to listen to you anymore. You cried wolf too many times. And so I'm going to become leptin resistant. And so now you don't feel full. So what do you want to do? You want to eat more because you're not getting that message to the hypothalamus, and now you get fatter, and the fat produces leptin. Leptin goes to the brain. You produce more. You become more leptin resistant. And so glucose or insulin resistance and leptin resistance oftentimes follow each other. It's a lot of hormone, isn't there? 5 minutes? 5 minutes of hormone therapy there, right there? You just learned endocrinology. And so it's a malfunctioning signaling going into the cells, into the brain, and into the cells for the insulin. And treating type 2 diabetes by giving you more insulin many times doesn't work. Now, again, I'm not an endocrinologist. I'm not telling you how to practice endocrinology. I know a lot of doctors listen to these shows. But think about that for a second. If it worked, maybe we wouldn't need it anymore. I mean, chiropractic care is amazing. I put bones back in place all day, every day. My doctors do. And it helps the pain go away. And it's awesome. But sometimes we need other therapies to go along with that. Sometimes when we're dealing with the body, we need other therapies aside from just the one standard approach. I did a show a couple of weeks ago, I guess, maybe last week, on options to pain management. We talked about chiropractic and acupuncture, massage, and proper diet and digestion and leaky gut syndrome, and all of that ties together. So it's okay to use different therapies to get you well. So when we talk about blood sugar, we're going to talk about other therapies aside what you may consider the ordinary therapies that you might want to consider because you can do these things. And that's what's so cool about it. So you want to make sure the nervous system is working properly because the nervous system is controlling everything. You want to make sure the digestive system is working properly so that you're breaking down your food and absorbing your nutrients and producing the right amount of leptin. And ghrelin is another hormone that's released in the small intestine. It goes to the hypothalamus and makes you feel hungry. So you got to make sure all that's balanced. And it's a tricky balancing act. I mean, really, I was on a guest on another show the other day, and I said something about we're really just sacks of meat. We're just meat sacks. And he goes, you call me a meat sack, jokingly. And I said, of course I am calling you a meat sack. That's all you are. I mean, think how frail we are. Every other animal, I was talking to a 13-year-old the other day, and she said every other animal has a defense except humans. A physical defense. We have shells and claws and fangs, and they're fast, or they can change colors, or they can fly. We got nothing, man. We got our brains, and that's about it, which is good. However, a mosquito can kill us. I mean, we really are kind of sissies when it comes to survival. So it's tough to play that balancing act. But we do that by making sure we don't dump our body with too much high carb. When I say carbs, breads, cookies, cakes, donuts, pastas, but that even includes some fruit. I only recommend 2 to 3 pieces of fruit a day. Now, I have a product called Dr. Joe's Essential Source. And what Essential Source is, it's fruits and vegetables in a powder form. We take fruits and vegetables, we juice it, take the water out at a very low temperature, and what's left is a powder. In the process, we take out the sugar. So fruits are great. They have a lot of nutrients in them, but the sugar is the downside. So we solved the problem by creating Dr. Joe's Essential Source, which is fruits and vegetables in a powder form. Then we had prebiotics, probiotics, digestive enzymes, a complete multivitamin. And as far as hunger goes, when you're hungry, you're not hungry for food, you're hungry for nutrition. So if I can give you mega doses of nutrition, your body oftentimes isn't as hungry. I have patients tell me almost every day, Dr. Joe, I'm amazed how much less I eat when I take the supplements you recommend. Because your brain is saying, all right, I need calcium, magnesium, boron, phosphorus, everything, nutrients, prebiotics, probiotics, microminerals, phytochemicals. And so you think, I'm hungry, I'll eat ice cream. Well, ice cream don't give you that. And then your body says, it's not what I wanted, I'm still hungry. So if you dose your body up with things like Super Greens and Dr. Joe's Essential Source, Super Greens gives you a lot of micronutrients, alkalizes the system. I do that for breakfast every day. And I don't eat a whole lot. Usually around 10, 11 o'clock, I might get a little hungry. I have a handful of nuts. I'll have maybe some flaxseed crackers. I'll talk about fiber in a second. Flaxseed crackers are awesome source of fiber and very low in carbs. And that's awesome for getting the body to balance itself again. And many of you, if you're the average person, has about 5, 10, 15 pounds of undigested rotten food laying in your colon. That's why if you ever do a colonoscopy, they give you the industrial strength colon cleansers, and whoosh, it flushes everything out. And you say, man, I lost a few pounds when I did my colon cleanse. No, you just cleaned out your colon. You can do that, by the way, by just eating good foods. And good foods are high in fiber, which clean out your colon, but it also slowly pushes the sugar through your colon, and you get a slow release of energy. So we're going to talk about something called net carbs and how many carbs you should be eating in a day. And that's really important. You understand that. So we're going to cover that in a second. And then we're going to talk about resistant starches. Starches, if you like them, which I do, how to eat them, cooked or uncooked. I'm going to talk about that in a second. You'll be surprised how you can actually eat a little bit more rice or potatoes and not have the reaction because they're resistant starches. And I'll explain that in a second. So, folks, if you want to come see us as a patient, again, we're a team of chiropractors. We work on neck pain, back pain, shoulder pain, headaches, numbness, tingling, muscle weakness. We always check the physical on all the patients because many times your healthcare problems are physical, not chemical. I have one team of doctors, and they work on urinary issues. And whenever they come across a patient, which is often, that isn't a urinary tract problem or a bladder problem or a prostate problem or uterus problem, they'll send them over to us and say, listen, a person's got back pain or radiating pain. We don't know what it is. Let's see if you guys can fix it. So the doctors are understanding that sometimes there's a physical problem that isn't going to be fixed by chemical and vice versa. So if you want to come see us, go to my website, drjoe.com, and you can set up an appointment. We'd love to see you. In the Atlanta area, we have offices in Marietta, Duluth, and Stockbridge. The supplements, the Super Greens, the Essential Source, my books. We have other supplements, vitamin D. We talked about that. We have a great Dr. Joe's vitamin D supplement with K2 to help your bones. All that's on the website, drjoe.com. And well over 1,000 hours of podcasts. Video, audio. This one, for example, is on the website, will be on the website. And you can listen and watch depending how you learn. Some people are visual, some people are auditory. And spend a little time there. I think you'll be fascinated when you start learning how the body works. It's so cool. Everywhere I go, I was at a school the other day, and the guy didn't say a word. I was just at a meeting, and I didn't say a word, and the guy comes up to me and goes, are you Dr. Joe? And I said, yeah. And he almost fell to his knees. He said, I can't believe I'm actually meeting you. I am blown away with the research that you do, and I'm such a big fan of your research. And he says, and I'm an educator, so thank you so much for everything you're doing. So it's really kind of cool that we're just looking at things a different way. So if you want to make an appointment, get the supplements, you have questions, go to my website, drjoe.com. I'm more than happy to help you however we possibly can. So talking today about blood sugar, diabetes, pre-diabetes, understanding what it all is. Because people come in all the time, I have diabetes. What do you do? Well, I take a X drug. And I said, okay, do you know why I have diabetes? Nope. Okay, anybody talk about what to do about it to maybe get your body normal again? Nope. So maybe we should start looking at educating the patient and giving them responsibility. I just did a report the other day on the doctor shortage, and I've talked about this many times, but it's getting really bad. We have a major doctor shortage. And it was funny because I read the article, and I'm going to do a whole report on this. And they had a dean of a medical school, and they said, we need more funding to send doctors to school. That's what we need to do because we need more doctors. What if we just got patients healthy? What if we taught patients how to maintain their own health so that the doctors that we do have, and of course I support new doctors coming into practice, take care of those patients. But if there's things you can do on your own, that would really solve the cause, not just treat the symptom. Symptom is we don't have enough doctors. The cause is we have too many sick patients. What if we just got people well? That's why I look at the nervous system, digestive system, and nutrition as being a protocol that I believe everyone should look at. And not everyone is going to respond to that. I got a knife in my back. I want a surgeon. I got bleeding in my brain. I want a neurosurgeon working on my brain. The best in the world I would want working on me. But what about things like simple blood sugar between 100 and 125 and you're pre-diabetic? Guess what? Stop putting the stress on your body. Stop producing so much insulin. And then the body will start to reboot itself and you'll lose that insulin sensitivity, which will then hopefully help you lose weight, which will help the leptin sensitivity, which will stop you from being so hungry all the time. And guess what? You're going to save a ton of money. That's the cool part. You'll save so much money by not eating so much or eating good foods. Whenever I go out to dinner, it's awesome. I go out with my friends, and I have friends that are normal, by the way. They're not all crazy like me. And I always have the cheapest meal. And it's not that it's the cheapest meal, it's the healthiest meal. It's pretty cool. So, all right, let me give high carbs. Gosh, this time flies so quickly. Most of the food people eat is messing up their metabolism, insulin resistance called metabolic syndrome, type 2 diabetes, almost every meal, and I see it happen every day. Most Americans burn glucose as their primary fuel, and that elevates your blood sugar, and that's where you start to have a problem. Because we should be burning glucose, but we should also be burning glycogen, stored fat, stored energy, and we should also be burning fat and ketones. And fat becomes ketones, and ketones is another thing we can use. And when the body has a better diversity of burning different fuels, it's more effective, doesn't age as quickly, reduces the risk of disease, gets cheaper. Well, not that bad a deal, is it? Good news is insulin resistance, metabolic syndrome, type 2 diabetes is usually resolved with proper nutrition and even proper exercise. Now, when I say exercise, some people get nervous. Oh my gosh, Dr. Joe, I'm not going to put on a thong and go to the gym and do aerobics. You don't have to. Just stay in motion. One of my secretaries who joined us, we do something at our office called the Doctor Supervised Weight Loss Program. And it's a protocol we put you on for 21 days. If you're interested, you can call my office, ask for Kayla, she'll help you. And it's a doctor supervised weight loss program. So we work with you. And the first 21 days, we lay it out pretty rigorously. This is what you're going to have, breakfast, lunches, dinners. You're going to take these supplements. You're going to take these shakes. And after 21 days, my one secretary, what'd she lose, 18, 20 pounds? She was amazed. And now I got her a pedometer, or she got a pedometer, and she's walking around the office. And you're supposed to get 10,000 steps a day. If you do 10,000 steps a day, that's the equivalent of a 20-minute aerobic workout. That's all you need, 10,000 steps a day. Nothing extra in your day, just like today. I parked far away at the studio and walked. It's very simple. Forgot my camera. Walked back up to my car, came back again. Now, I could have parked closer, but why should I? Why shouldn't I park further away? Anyway, she said, Dr. Joe, I'm doing 6,000, 7,000 steps a day now in the office. She goes, so I'm getting my steps just running around the office all day. And then, of course, she does her life, and that adds the extra 3,000, 4,000 steps she needs. And I said, what are you doing differently? You worked in the office before. She goes, I have the energy now to get up and move. And that's the difference. I'm able to get up and move around. I said, that's really cool, isn't it? She said, I can't tell you. She goes, I've tried to lose weight all my life. I've tried every diet, every program, every pill. Nothing's ever worked. She goes, this has got me jump-started, and now I understand how to eat. So it's really kind of cool. So anyway, if you want more information, you can go to the website, drjoe.com, and reach out to us. And Kayla, by the way, will set you up for that. So got a lot to talk about. I want to talk about net carbs. I got to go to a break pretty soon. I'm looking at the clock here. We're going to talk about net carbs. We're going to talk about getting more nutrients in your body. Certain nutrients work very well to metabolize food, like magnesium. Most of us don't get enough magnesium, and you can get that by eating nuts. But if you eat too many nuts, you'll gain weight. People always say, how do I lose weight? Other people say, how do I gain weight? And I always get them on nuts and seeds, and a lot of avocados. One a day is fine. More than that could be a little stressful on the body. So we come back, net carbs, more on the nutrients that you need to get the body working properly to balance out the blood sugar. Oh, by the way, I was told this by my office. The supplements, the Super Greens, the Essential Source, we have an in-office special running. If you come to the office, you can't get it on the internet, and it's going to save you shipping too. If you come to our office, if you buy 3, you get 1 free. That's really amazing. I'm shocked that my staff is even doing that. But if you come and pick it up, we have offices in Marietta, Duluth, and Stockbridge in the Atlanta area. You can buy 3, get 1 free. And sign up for our newsletter, by the way. Go to my website, send me your email address, because we send out news, we send out articles, we send out information when we're giving live lectures. Many times we'll have specials on the supplements and the books, and we only send that out to the folks who are on our newsletter. So give us our newsletter. Follow me on Facebook. Follow me on Instagram. We live broadcast a lot of my shows. If you want to come live, you can always do that. If you want to make an appointment to come see us, neck pain, back pain, shoulder pain, if you've ever been in a car accident, if the car was damaged, you were damaged, you need to come see us. Stop suffering needlessly. drjoe.com. Thanks for listening. We'll catch you next time. Thanks for listening to For the Health of It. Remember to subscribe to this podcast, and I'll help you naturally get well and stay well. You can also listen to and call into my radio show live Sunday evenings from 7 to 9 Eastern Time on WSBRadio.com and on the WSB Radio app.